Will AI replace medical coders? The landscape of medical coding is shifting with the rise of artificial intelligence, AI. As healthcare continues to evolve, the efficiency and accuracy of coding processes have become paramount. AI technology now plays a crucial role in transforming how medical coders operate, igniting discussions on the potential replacement of human coders by intelligent algorithms. Firstly, it's essential to recognize the capabilities of AI in the realm of medical coding. Machine learning algorithms can analyze vast amounts of data, identifying patterns and discrepancies that are often missed by human eyes. This capability not only enhances the speed of coding, but also minimizes errors, a significant advantage in a field where precision is critical. Moreover, AI can adapt to changes in coding standards, ensuring that practices remain compliant with the latest regulations without the extensive training human coders require. However, while AI brings numerous advantages, the notion of completely replacing medical coders raises important questions. Human coders possess nuanced understanding and contextual awareness, enabling them to interpret complex medical records accurately. They can assess clinical documentation pathways and engage in decision-making that reflects a depth of knowledge beyond mere data processing. This human intuition and critical thinking are vital in situations where the coding is ambiguous or requires clinical judgment. Moreover, rather than viewing AI as a replacement, it may be more accurate to consider it a complementary tool that enhances the role of medical coders. By automating repetitive tasks, such as data entry and basic coding, human professionals can focus on more complex cases that require their expertise. This collaboration can lead to improved efficiency and job satisfaction, allowing coders to engage in higher-level analysis and become integral parts of the healthcare team. In conclusion, while AI is poised to reshape the medical coding profession, the complete replacement of medical coders seems unlikely in the immediate future. Instead, a hybrid model where human coders and AI coexist may emerge, optimizing the benefits of both worlds. Medical coders will continue to play a vital role, utilizing AI tools to enhance their work and ensure the integrity of coding practices. This evolving relationship signifies a promising future for medical coding, ultimately improving the quality and safety of patient care.